We're here with Helen from New England Fertility. She is our ultrasound technician, and here we are going to have her show us an ultrasound that was taken before an egg retrieval after 4 days of medication and about a week and a half before the egg retrieval. So Helen's going to show us exactly what an ultrasound pre-retrieval looks like. Take it away, Helen.
Okay. So first of all, we start with this one picture here, which is a picture of the uterus. I like to see that, make sure that the size of the uterus looks normal, and all the texture of the uterus also looks normal. I'm going to hit over here where we started recording, and that is recording of the lining of the uterus, the cavity. It's nice to see 3 lines like that. It's called trilaminar.
Which part is the lining exactly?
Right there where it's being measured.
Okay.
Right there where it's being measured with the little arrow. And then we're just doing a scouting. I'm going to be looking at the ovaries now. That seems to be the bladder, and those little black dots there, those are what we call follicles. That's what we measure during the time when they're stimulating. So you'll see me start measuring one at a time. And this is for someone who has been taking medications for about 4 to 5 days. First I measure the entire ovary like I just did. And then I just measure all the smaller follicles. Gives us an idea of how well she's doing and when will she be ready for a retrieval. The measurement of the follicles and the lab results both dictate how well she's doing and when she'll be ready for a retrieval.
So how well the medication is working also?
Yes.
Okay.
So that's that one side, that's the left side. And as you can see, there's a lot of smaller ones, and that's pretty appropriate for someone who's been on medications just a few days.
So these are average size. It's a totally normal ultrasound. Okay.
Yep.
Awesome. So, and this is just a week and a half out from retrieval. And you do another ultrasound before the retrieval?
We do ultrasounds every other day. Once they start shots, we do ultrasounds every other day. And we do blood work as well to make sure that the labs and the eggs are kind of go hand in hand as far as the maturity of the follicles and the levels of the hormones. This is the right side. Same thing. I usually just go ahead and measure the entire ovary, and then I measure the follicles one by one. Dr. Levy then looks at these follicles along with the lab results for the day, and that's how he makes a decision as to if she should continue with the same medication or if we needed to start any other medication for the cycle.
Awesome. And then we have our measurements. Okay.
That's pretty much it for monitoring during an IVF cycle.